Oh, hello there. You must be my 3 o'clock appointment. Perfect. Could you just confirm your name for me? Thank you. Perfect. You take a seat there. Make yourself comfortable. Okay. I'm just having a little look through the notes. Right. Well, my name's Dr. Sarah. Pleased to meet you. How are you feeling today? Okay. So you're experiencing some neck pain, headaches, okay, and dizziness too. Okay, let me just jot a couple of things down. Alright, is your neck feeling really stiff when you turn it? Okay. Have you had any accidents in the past or recently? No? Alright. Right, have you had any recent infections at all that you're aware of? Alright, okay. Let me just see about your history. You're not on any current medications, are you? No, alright, okay. So we've not seen you before for any dizziness or anything like that, which is good. Okay. Alright. Are you taking any pain relief? Just paracetamol. Okay. That's fine. Have you got any problems with your vision or sense of smell at all at the moment? No? Okay. When you get your headaches, are they like migraine? Do they make you feel nauseous? A little bit. Are you getting any flashing lights in your eyes at all during the headache or before? Alright. Okay. Do you wake up with the headaches? Okay. Do you have any sinus pain or pressure? Sometimes. Okay. Well, I will take a look at you shortly. Alright. Tell me a little bit about the dizziness. Does that happen at random times? Or does it happen when you move your head in a certain direction or when you lie backwards? Okay, so it's when you turn your head or lie back. Okay. And the pain in your neck, does it radiate down your shoulders slightly? Right. Okay. Does the area feel warm at all? No. Alright. Okay. Just make a few notes there. And how long have you been having this neck pain, stiffness and headaches? A couple of weeks now, okay. You thought it would just go away on its own. Well, sometimes things come and go, but it's always worth getting these things checked out, of course. Right. Okay. Do you have comfortable pillows at night? Do you sleep on one pillow? Two? Just the one, okay. You find that a deep pillow makes your neck pain worse, okay. That's fine. And do you use memory foam? You do, okay. Alright. Okay. Are any other parts of your body feeling sore or achy at the moment? Okay, your other joints don't feel at all tender. Okay, and you can move around absolutely fine apart from in the neck area. Okay. Have you had any pain and numbness, tingling in your arms, fingers, down your back? No? Okay. That's good. And do you get any really sharp pains in your neck or head? No, okay. So can you explain how it feels? Is it more of a soreness or a constant niggly pain? Okay, so moving it makes it feel really sore, yeah, but it does feel a little bit like toothache, but in your neck. No, I understand. That's fine, okay. All right, have you tried doing any stretches at all? Just gently stretching your head from side to side? All right, and do you spend a lot of time on the computer at all? You do, okay. Have you checked your posture? Do you tend to slouch a lot? Okay. And are you spending a lot of hours in front of the computer in one go? For example, you're not having a break every hour. All right, and I presume this is all work related. Okay. Do you look at a laptop or iPhone when you're in bed at night? Okay. All right. It's very easy for all of us to forget our posture, and that can put a lot of pressure on our shoulders, upper back, neck, and the pain can radiate into the head as well. Okay, right. Well, neck pain can affect the ears, but of course with ears there could be other things going on as well, which I will check out for you. All right. Okay. So, firstly, I'm just going to take a little listen to your chest, if that's okay, with my stethoscope. Okay. Pop my gloves on. You've not had any cough or anything like that recently? No, that's good. Okay. I can't see you've had any asthma or problems in the past on your notes, so we're good to go there. But I always like to have a listen. Okay. So I'd like you just to keep nice and still for me there. And I'm just going to place the stethoscope just onto your chest, and I'd just like you to breathe normally at first, please. I'm just going to listen to your heartbeat. Okay, let's just put that there. Make sure this is nice and warm for you. Okay, just breathe normally for me. That's perfect. Okay, well, your heart sounds perfectly fine. Normal, nice rhythm there. Nice and strong and clear, so that's good. Okay, this time I'd just like you to take a nice deep breath in, okay? And I'm going to move the stethoscope around. I'll ask you to breathe in and out. Okay, so pop that there and in and out. Good. And in and out. Okay. And in and out. Okay, just round here and in and out, and here, in and out. Perfect. Could you just do a little cough for me? Okay, and one more. That sounds absolutely fine. Can't hear any crackles or wheezes or anything unusual there. That's perfect. While I've got my stethoscope, I'm going to check your blood pressure, if that's okay. Right. You've had this done before? All right. Okay. So what I'll be doing, I'll be popping this cuff around your arm, okay? I'll be placing the stethoscope into the brachial artery, which is just there in your arm, okay? And then I'll inflate the cuff and then gently release the air from the cuff to read your blood pressure. Okay, so let's try your right arm first. If you just outstretch that for me. Thank you. Okay. So let's just get that on there. Make sure I've got it on nice and tight. There we go. Is it okay for you? Right. Perfect. Just make sure my valve is nicely closed, else it won't inflate. Alrighty. Just going to pop the stethoscope onto that crease in your arm now and inflate the cuff. Okay? Alright, keep nice and still. Okay, I'm sorry that's tight. Alright, just gently letting the air out now. Okay, that seems fine. I'll just take the remainder of the air out of there and take that off your arm. That's a relief. I always like to try blood pressure on both arms, if that's okay. So if you just outstretch your left arm, I'll pop the cuff on there. Okay, lovely. Alrighty, so let's just do up that valve and I'll inflate the cuff. Make sure it's nice and tight around your arm. Okay, pop that on there and here we go again. Okay, good. Gently letting the air out now. Okay, that's all good. Just remove that, make you nice and comfortable. Get the rest of the air out. Perfect. Let's pop all that down there and I'll just make a note of your blood pressure. Okay, it's coming out at 105 over 80. Okay, a little bit lower on the upper reading, the systolic reading there. Normally like to see it about 120, but that's fine. Okay, it was 110 on one side and 105 on the other, but I'll take the 105, there we go. Okay. So, now we've done the stethoscope part, I'll be doing a little bit more of a check over your eyes, your lymph nodes, okay, having a little look in your mouth and checking out the neck and down your ears if that's okay. Alright, well you just relax there and I'll just grab a few things to check you over. Okay. Right then, let me just take your temperature. I'm not going to be putting it in your ear, it's just something that I point at your head. You'll just hear a couple of little beeps, okay? Alright, just keep nice and still for me. I'll just... That's perfect. Okay. Temperature's 36.8. That's fine. Checking out good so far. Okay, let me just have a little feel of the lymph nodes around your neck. Okay, so just keep nice and still for me. I'm just going to gently press around your ear, under the jaw, down the neck and across the collarbone. Alright, tell me if anything feels uncomfortable or painful. Alright, okay then, here we go. So just behind the ear, okay, and then the pre-auricular, okay, just down there, okay, under the jaw, and just down the sides, gentle little movements. Nothing feels sore? Good. Okay. I'm just going to press across the collarbone. Okay. Okay. Could you just lift up your arm for me? I'll just check the lymph nodes that are under your arm. Okay. I'll hold your arm up, no problem. Okay, there we go. Nothing sore there? Good. Okay, that's fine. Let's try this side. Okay. I've got your arm there. Let's have just a little press. That's fine. That's fine. Make a little note of that. Okay, so this is the bit that nobody really likes, but don't worry, I won't push the tongue depressor in too far. Okay. Just going to take a little look in the back of your throat. Okay, so I'd like you to open your mouth for me. Nice deep breath. Breathe through your nose. Okay. Alright, there we go. And I'm just going to shine this light just into the back of the throat. Say ah for me. Okay, and again. Alright, just take a little look around the cavity there. Can you just pop your tongue to the roof of your mouth for me? Okay, I'm just going to move your cheek away there. Just look on the right hand side of the cheek. And again, this side, just move the left cheek and just have a look in there. Okay. And one more time. Oh, for me again. Okay, wonderful. No problems there. So let me just have a little check of your eyes. You're saying that your eyes aren't feeling too uncomfortable, but they do ache with the headaches. Alright, okay. Firstly, just look straight at my nose for me. I'm just going to check your pupillary reaction. I'll just bring the light in and out. Okay? Alright, so straight at my nose. Okay. Just checking those pupils. Absolutely fine. This time I'd just like you to follow my light, okay, wherever it goes. Don't move your head, just follow the light. Okay. That's great. Just follow. Up and down and up and down, okay? Up, down, okay, across and across, and just follow the wavy line. That's wonderful. Perfect. I'm happy with that. Okay. Now, just have a little Snellen chart here. Can you just tell me if you can see that letter there? Okay, perfect. Can you read that line for me? Alright, that's fine. What colour is that? Okay, and what colour is that? Perfect, okay. Can you just cover up your right eye for me? Wonderful. Okay, can you read that line? Good, okay. Can you now cover up your left eye for me instead? Okay. And can you read that line? Okay, that's fine. And that didn't make you feel dizzy at all? No. Okay. Right. I'd just like a little look in your ears, okay? I'll not move your head because I don't want to make you dizzy, but I just want to see if there's any problems down your ears that I can see that can be contributing to the ear pain. I'm going to use this otoscope, and it's got a little light in it, and I'll gently insert the speculum into the ear canal just to check the structures down the ear, just to make sure I can see it, there's no infection and there's no wax impaction. Alright, so I'll start with this ear first, okay? So I'm just going to gently pull up and back on your ear and gently insert the otoscope. There we go. So just having a very gentle look around. The ear canal looks perfectly fine, no redness. I can see the structures behind your tympanic membrane, your eardrum. There's no bulging or wrinkling, no visible fluid, but I can see the structures of your ear perfectly. Very clear of wax, just a normal amount. So I can't see anything which would indicate an ear infection. Definitely not on the ear canal. Okay, I'm going to gently remove the otoscope now. There we go. You okay? Good. I'm going to do the same on this side now, okay? Alright. So, just going to gently pull up and back and insert the otoscope. There we go. Is that okay for you? Good, good, good. Right. Again, the ear canal. Looks very clear, no redness, no swelling, no skin problems, and the ear canal is visible. The ear is free of wax, again a normal amount, no obstructions, and I can now see the eardrum and the structures behind. Again, no visible fluid, no bulging, no wrinkling. That's a very healthy ear. Okay, I'll gently remove that now. Okay. Is that alright for you? Good. You don't feel dizzy? No. Okay, that's fine. So we're all clear there. Alright. Now, I'm just going to do a couple of little movements, okay? Right. So, just let me hold your neck a little bit. Just tilt your head that way. That way. Is that sore? Okay. Could you just tilt your head back slightly for me? Okay. Is that making you feel a bit dizzy? Alright. Okay. Could you just shrug your shoulders up for me? Okay. And can you just try and tilt your head forward? Okay. Alright. Just move your head like that to the side. If I press, does that feel sore? Okay, back to the centre. Okay, I move it the other side. Does that feel sore? Okay. Okay. Let me just press on your face. Does that cause you any discomfort? Not too much, okay. Alright. Just press up the top on those sinuses up there. But that's not really hurting you so much. No. Okay. Could you just raise your arms above your head for me? Okay, is that hurting your neck? A little bit. Okay. Just relax now. I think I've put you through enough there. How's your head feeling? Are you still a little bit dizzy? You're okay, that's good. All right. I don't really want to trigger that too much. Okay, well, I can't find anything visually wrong inside your ears. You do have reduced movement in your neck. Okay, it just seems to be very, very stiff. And what I'd like to do, because I can't see that you've got any ear infection which would be causing the dizziness, it may be down to the fact that you have some little crystals inside your ears, okay? And they can move around and get lodged in areas they shouldn't be in, and they can cause the brain to get confused when you move your head, hence causing like the spinning dizziness sensation of vertigo, okay? They're just like little build-up of calcium crystals called otoliths. Alright, but they can cause lots of problems. Okay, I didn't notice your eyes jerking around too much when I was moving your head, or not at all really, so that's okay, because that's another sign of vertigo. It's called nystagmus, and your eyes can jerk when you're dizzy. But maybe if you were having a more severe attack, that would happen. Right, okay, so I think the best course of action is for me to refer you to our chiropractor, Yvette. She's absolutely wonderful, and I'm pretty sure she will be able to get to work on your neck and reduce this neck and head pain, okay? And also she can do some manoeuvres that can help with your dizziness in your ears as well. I'll leave that up to Yvette to decide what she wants to do. She'll check you out as well at first, okay? But I am absolutely confident that her chiropractic technique will really help release your stiffness and soreness and help with that dizziness. Yeah? Okay. So we'll put that through now. You should be able to get to see Yvette very, very soon. Okay, she's absolutely lovely and she will take the best care of you. We have wonderful results with Yvette. Okay, so you go home and rest. Alright, and you'll get a phone call from Yvette and she'll get you in to get those adjustments done. Okay? Alright, okay. Bye bye.
Good evening. Thank you for coming in. It was nice to have that brief chat with you on the phone and the referral from Dr. Sarah. It's, in your own words, I have her report, but in your own words, what kind of problems do you believe you're experiencing? Okay. I'm just checking her notes here. Just some of the observations and tests that she had run on you. Okay. So no build-up history of congestion, sinus infection, anything like that. Okay. Yeah, and your results looked otherwise very normal, very healthy. Okay. Well, we're going to go on the guesstimation that this may be something in your vestibular system, in your ear canal, possibly neck related, swelling, agitation. Okay. Well, with your permission, I'm going to sanitize my hands and just feel around, start on the outside, see if we can pinpoint any locations, any areas where pressure tends to cause you to feel woozy or trigger the dizziness, okay? Okay. It's not a test. There's no pass or fail, so you just tell me what you're comfortable with. Okay. Is it okay for me to place my hands on your neck, around the back to your skull? Kind of palpate things like your lymph glands, your jawline. That's okay. Okay. And you please let me know if there's anything that makes you feel uncomfortable and we'll move forward, okay? Alrighty, thank you. I'm going to start in the front here just to get in order. lifting of your chin just a little bit here. Just a little further down your neck. Okay. And what about pressure behind your ears right here? Any dizziness? Mainly if you move around a lot. Okay. Back to the back of your skull. Okay. That does feel a little bit of pressure. Okay, can you describe it for me? Kind of like a toothache, but no, that's actually a very common description. And a lot of the nerves that go to your teeth and gums go down the back of your neck, so if you have anything that can agitate that, even just tightness of the jaw, swelling, misalignment of the neck, things like that can definitely... So you feel extra pressure when it's right here. Okay. Mainly on your left side. Okay. On the same position on your right. Okay. I'm going to take a quick look on the inside of your ears just in case a circumstance has changed that might differ from her notes. Okay. Yeah, we're just going to be looking for swelling, infection, any kind of discharge that might be going on. Okay. And this might feel a little bit cold in your ear here, so just try to relax if you can. Okay. If I pull on your ear like this, does this cause any discomfort? Okay. Just gonna stick it a little bit deeper. And pull down on your earlobe. Okay. Gonna do the same on the other side. And pulling up. Anything? Okay, what if I pull down? Okay. Just gonna a little bit deeper. Ears are nice and clean. Just a little bit of swelling. That's not really unexpected. But it doesn't look like you have any kind of discharge or anything like that coming out of the ear. It doesn't look like it's something that would be caused by viral or bacterial. Okay. Now I want you to try to sit still as much as possible. And I'm going to move this light. I want you to try to focus on it. I'm going to move it relatively quickly, and I want you to try to follow it, okay? You're getting quite a bit of stagness. Just focus on it for a moment. And again, just focus on it for a moment. Okay. And one last time. Okay. Stagness is when your eyes are not able to completely focus on an object, and your pupils will a lot of the times shake a little bit. It's a common side effect. So it does seem to be more sensitive on this side for you than any others. And your neck, I'm going to palpate on those muscles that go up and down your spine here. So just try to relax, okay? Yeah, they're a lot more tender on your left side. It's not bad. What I would be inclined to believe is that left ear might have a little bit more mineral or calcium deposits in your vestibular system. And ultimately what that does is it prevents the ear fluid from moving, and your brain doesn't accurately get the signals about what position you're in, which is what triggers that spinning sensation. Okay. I'd like you to try to sit as still as you can. I know that that's easier said than done sometimes. Grab onto the sides of the bed here. I'm going to be moving your head from side to side. I want you to tell me when that sensation of severe dizziness kicks in the most, okay? You're nice and safe and secure on the bed here. You're not going to fall off, even though it might feel like you are, okay? Just try your best to relax if you can. Okay. Firmly place one hand on your shoulder and the other on your neck. And just gently allow your head to rotate in the palm of my hand, okay? Is that okay? Okay, right there. I got you. Just close your eyes if it helps. Okay. I know sometimes this can take a couple of seconds before it'll slow a little bit. Okay. You alright? Okay. We're gonna move on to the other side. You're okay. And here we go again. Your neck is quite stiff. It's very resistant. Okay. Gonna turn your neck a wee bit. And then back to the other side. Not so much on that side, okay. I'm going to try that again and just try to remain still. Okay, and you get the sensation at that position right there. Okay. Just rest your head in my hand. You're alright. You're not going to fall over or anything, okay? Alright, move your head back into a resting position. Okay. You alright? Okay. Just take a moment to compose yourself. Relax, there's no rush. Okay. Just looking at your posture. Have you ever noticed that one shoulder becomes more sore than the other? Doing work on the computer with one arm extended. Okay. Alrighty. Just going to press on each shoulder a little bit. And this will allow me to see which shoulder has a little bit more resistance and which one is the more normal, okay? And this shoulder is not quite as tense. And now on this shoulder. So one is elevated and much more tender on this side. Okay. A little bit towards the back. Just trying to get a good look at it. Okay. I'd like to do some exercises with your neck muscles while you're laying down. Hopefully that will relieve enough of your balance and stress so that you're not tightening up your neck. And we can also work on making those muscles feel really, really nice and relaxed. Get a better look at your rotations. Also, maybe do the upper maneuver because I believe with your stagnus and the extra tenderness that's happening on your left side, I do think that that's probably the side of the vestibular system that has the crystallization. Okay. That won't hurt at all. It might not be the most comfortable, but ideally if we can get that crystal to go to one side of the vestibular system and it attaches itself to the wall, or at least stays in that position, it will very much reduce the spinning sensation. It kind of settles down into one area. Okay. Let's get you laying down on the bed. I'll help you down so that you don't fall off or you don't have any of that uneasiness. And we'll cover you with a blanket so you can be nice and cozy. And if after this procedure, if you just want to take a rest, there's no urgency to get up. You can just remain in a very calm and peaceful place, okay? Alrighty. Let's get you laying down. Okay, how are you feeling? Yeah, just take a moment and gather yourself. There's no rush. And we're just going to try to remain in this position until the spinning stops or at least settles a little bit. And I'm just going to place my hands under your neck and feel for difference in temperature, okay? Are you comfortable enough? Okay, that's always good. Okay. How's the spinning? Okay, just little spits and spurts. Okay. I'm going to start with some circulation techniques. So I'm going to do some effleurage movements up and down the neck, and this should help those muscles to relax and relieve some of the tension and pain that you're experiencing in your head, okay? Okay. I'm just going to recline you a little bit. I'm going to keep your head nice and straight, though. I don't want you to look into the sides just yet. Is that okay? Okay. Just going to focus on some nice, gentle strokes. Up and down the sides of the neck. I believe the majority of the problems are spurring from your left side here. So I'm going to gently cup one hand around your face. You might feel a little bit of spinning on that. You're going to be nice and safe and sound here. I'm just going to rotate your head a little bit. Focus on these muscles in particular, okay? You doing alright? And just give you a moment there to fully relax. Gentle strokes. And the other side. Back to center. To help with some of the circulation as well as your flexibility, we're going to make 5 adjustments. So we're going to do from the very base of your skull, C1, 2, 3, 4, 5, and that way we're just going to pull backwards. We're going to stretch those vertebrae as much as we can. That'll help with your general flexibility as well as allow those muscles to relax a little bit more, okay? So what I'd like you to do is take a deep breath in, and as you exhale, try to focus on resisting any kind of muscle tension in your neck. So I'm going to be doing the physical manipulation. I just want you to try to let go and don't fight it if you can, okay? Yeah, I know sometimes it doesn't feel like you have much of a choice, and that's okay. And as you exhale, just try to relax. See, we got a very good, very easy adjustment that first time. Good job. I'm going to move down to C2. Very good. Good, good. C's not that bad. And C3 here. And C4. And India. Good job. Okay, we're going to do just one more. This is almost to your shoulders. You can feel those muscles dilate to your shoulders, your traps. And try to let go as we exhale. Very, very good. Good job. Okay. So, the main vertigo issue, assuming it's on your left side here, we're going to do the Evoke maneuver, and I'll help you get into position for this. But what we're going to do is we are going going to tilt your head back and then to that side. And that little calcium crystal is going to travel to the very bottom of the hoop. Then we're going to rotate you so that you are on your side. I'll help position your body. But this will allow the crystal to continue down that spiral. And then we're going to rotate your head back farther, back to center and just off of your right. This is going to cause it to side to your right. And then this is going to cause that calcium crystal to continue. And then we're going to sit you up nice and straight. Okay. Does that sound okay? Alrighty. So I'm going to pull you back just a little bit and position the pillow a little further down your neck. Okay. And you might start to feel a spin, and that's okay. Just try to focus on where your back is meeting the bed here, okay? You got this, you're alright. Just breathe. Yep, and I can see the stagnance, and that's normal. Okay. I'm going to rotate you a little bit here. I gotcha, you're alright. Just let that subside a little bit. Okay, are you ready? Okay, here we go. Okay. Right about there. You're alright. You're not moving. I know it feels like you are. We're going to look down to the side. I'm going to sit you up a little bit. Okay. And we're going to rotate you to the other side. Back down the center. Back. Okay. And then we're going to sit you up nice and straight. Okay. Okay, how do you feel? Okay. A little less spinny? Yeah, but it still has that effect on you. Well, I'd encourage you to try to take the day as calmly as you can. No sudden movements. Try to keep as still as you can. Preferably upright if you can. If you want to relax and try to sleep, if there's any way that you can do so, A little bit inclined would be recommended. Drink lots of water. Okay. Well, you do look like you're nice and peaky, so that means good circulation to your head, to your brain, to your vestibular system, where we want it to be, okay? Try to relax those shoulders a bit. Okay. Well, if you have any other concerns, or if this has any flare-ups, if it doesn't get any better, then there's always an ENT. We can go to the next couple of steps and see if there's any other further treatment that we can go with. This is usually pretty effective. Alrighty, my dear. I'll check in on you periodically, but again, if you need me, don't hesitate to stop in to see me or Dr. Sarah. Take care. I'll see you later.